famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about knee pain, three most common symptoms, treatment, and prevention.
Bob, between the two of us over the last combined 60 years of therapy treatment, we have seen thousands and thousands of knee pain, people with sore knees.
Yeah, we started off with Abraham Lincoln's knee, and we've moved on since then. So
yeah, he was a tough one.
Yeah, he was a tough one. So
seriously,
I think we got some advice that can help you.
Absolutely. We got a really nice setup program. So
by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Go to Facebook. The contest will be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. So,
all
Brad,
right.
What is the most common symptoms?
Well, I did not find any studies that had this clearly mapped out, but I think it's a no-brainer. I think most anybody would agree. Arthritis.
Yeah, especially if you're older, if you're up in those, even sometimes 40s.
Right.
We're seeing now people with knee replacements.
Right.
But certainly when you get into the 50s, that's when cartilage is starting to break down.
Right. And it's really proven by the number of total knee replacements. I mean, just in the United States in 2017, 966,000 total knee replacements.
And we were just discussing this, Brad. We remember just not too long ago, what was 700,000?
Well, 700,000 or 800,000. I was at a knee course, and it's just a few years later than that. And I'm sure if I got
it's skyrocketing.
Yeah, I'm sure it's over 1 million in 2019,
right.
and it continues to go up. And they're do better and better now. They only do total knee replacements. They do partial knee replacements, and now they're talking about digitally 3-dimensional custom knee replacement.
Really?
Yeah.
Interesting.
So anyways, if you have that knee pain from arthritic, it's typically with weight bearing. The more you walk, going up and down stairs, irritates it. The pain is in the joint, but it continues to ache when you're non-weight bearing for time. This is something that is not proven scientifically, but pretty much every patient I see, they say they can predict the weather because of their knee pain, typically arthritic problems.
And that is not proven scientifically,
no, it's
unfortunately.
not.
But I hear everybody say
How many people did you say?
They all say it. So,
anyways, you can get medications from your doctor to help remedy this to a certain degree. Over the counter, ibuprofen, depends on the individual. We want to show you some therapy treatments.
Right.
There's the other thing, glucosamine. Did you know that glucosamine is made up of ground up shells from shellfish?
I did not know that.
Yeah. There's some other stuff put in there. I was just talking to Chris, the pharmacist, about this. But overall, it's done well, but it's not a go-to. There's no proof that it's going to take care of it.
Yeah, unfortunately, Brad, I don't want to rain on your parade here, but I saw a study where they felt it had very little help.
Yeah.
Glucosamine.
Right.
Now, other things, though, has some benefit. Just because you have arthritis does not mean you're destined even to have a knee replacement anytime soon.
Right.
It's amazing. Sometimes arthritis can actually get a little bit better by doing some of the exercises and doing some movement. They recommend now that you don't necessarily stop running, which my wife, she had stopped. I mean, she had a really bad episode. Stopped running. Yeah. She ran last night. She ran this morning.
And she was on crutches for a while.
She was on crutches, and I never thought she'd be back to running. But they're finding now that that movement, and you're getting the natural fluids moving in there.
Keep it moving.
Yeah, keep it moving.
All right, so we're going to show a simple exercise for it in a seated position. This is good pretty much for all ages. If you have balance problems, it's fine because you're seated. And it's simply, we call them long arc quads, or I say to my patients, do these kicks, bring them up as high as you can and down. So we're not just swinging it, but it's actually a real determined what's the word I'm looking for?
Well, what's nice,
Dedicated
it's
kit.
controlled. What's nice about it, Brad, is you're not only getting some movement, which if you sit all day, that's what you need to get. You want to start getting movement, but two, you're getting some strengthening.
You're right.
So you're getting a double whammy here, and not whammy, double benefit here. So whammy's bad, right?
I think it is.
Yeah. So.
Well, you never know. We could change that.
So this isn't something you do once a day in your chair. This is something you do every hour in your chair.
Right. As long as you can tolerate it and you don't wear yourself out.
Right.
But make sure you do about 10 of them. You don't have to do 30, 40 of them. But, 10's a good number. I've had people do this just before they get up, and it makes their knees feel better. That initial few steps can be real painful. That's a good option for there. The other thing is do your knees go all the way straight? If they don't go all the way straight, let's say this is my painful knee and the other one's not so bad, and you notice I go out to here and it doesn't straighten out where this one goes completely straight. This knee we want to see if we can get it to go straighter. You can put it like this with your foot on the floor and simply do some exercises, stretching like this, pressure on, pressure off, 5 to 10 times, and get it to go straighter.
And again, you would do that throughout the day.
Right.
Now you can also use a stool if you'd like to, put your foot up on a stool.
Yep.
But this is nice because you can do it anywhere.
Right.
Yeah, I mean,
and the big thing is don't get too aggressive with this right away. Be gentle with it. I know Bobby always talked about the patient that was doing this, and he really got sore because he was.
Yeah, he was 90 some years old. I had him come in. I was like, he was making gains the first day already on stretching, so he just went to it, and then he almost didn't come back
because it was so.
And luckily he had a good result in the end. But it took a little bit of talking down from the ledge there because he was pretty upset with me.
Sure.
So,
the next thing is, does it bend all the way?
Right.
If you
compare the two sides.
If this one only goes this far, and this one bends all the way in here, and this one goes to there, we want to get this to equal the other side. So you can do this one in the chair as well. Put your hands around here and pull and see if you can get it to bend and go pressure on.
Sorry, Brad, I didn't prepare for this, but actually a good one that works well with that is to actually take a towel and place it in the knee. This is a sock.
A rolled up towel, maybe 2-3 inches in diameter. It'd be about like this. And
then you pull like that, and that just helps kind of gap the knee joint, and it helps you gain faster. Now, it should be pain-free.
Right. It should actually feel better with it. If it makes it feel worse, it's not the proper option.
It's a great technique. It's a nice adjunct in your toolbox there to get there.
All these are little tricks that we've learned along the road.
Right.
The other things that you can do, so you can work that. If you have pretty good range of motion, we're going to go into prevention. Let's say your knees hurt. Not too bad, but you want to keep it from getting worse, or they're feeling good, and you want to keep
them. They maybe recovered from a painful incident, and you want to keep it moving.
Swimming, a lot of people don't have access or they don't like water, but if you want to do that, swimming is non-weight bearing. Keep those joints moving. 15, 20 minutes in the water or more. Take one of those classes. Aerobics class in the water. The other one is biking.
Biking's a great
Stationary bike. That can work out good.
Or biking outside on the road.
As long as you're safe with it. Be careful.
But biking's really good for your cardio, obviously, but also it's really a great one for the knee joint because it's moving that knee joint without putting too much stress on it. Obviously, if you have pain with it, you can't do it. But Brad's also going to show you another option here.
Yeah, this is a nice option. It's a real nice portable device. You can take it anywhere. Pretty much, you can put it in a suitcase and take it on the road with you if you want. But just sitting down to keep those knees moving.
Yeah, it fits under your desk. It works out real well.
We call this a Fit Glide. We're very familiar with it. It works very well. It has an advantage of actually going on an angle like this, and you can work like this. You got those painful knees, and walking irritates it. This is a beautiful option. Spend 5 minutes on it 2-3 times a day. This actually works the hamstrings pretty well.
Yeah, you don't stand on it.
No.
There's a little bit of sound to it, little swish, swish, swish. So don't, if you're going to use it in your office, understand that people might hear it.
Right. But it's not a big deal. So there you go. This you can go out to the link below our video if you are
Actually,
interested.
Brad, I think this works for the second problem too.
What?
Swelling.
Oh yes, keep that knee
fluid moving. Yes.
As long as it doesn't irritate it.
Right.
If it's.
But if you especially have knee swelling that tends to migrate into the calf. I mean, the more you get movement, the more. A lot of times that encourages that swelling to go out and up into the abdomen where it gets processed.
Get those muscles working.
Yeah.
Another thing, because this is your second most common cause, is swelling.
Right.
So should we show them elevation? This is my favorite #1 go-to elevation. You could take 2 pillows, maybe 3 pillows, set them down on your bed or on your couch. I like the leg wedge. It works really well. It's very comfortable, and they're not very expensive.
Well, they're nice for back pain too.
Oh, yeah. And just elevate it so you can see my knees are above the level of my heart, so the gravity is going to help that swelling flow the other direction. If they're swollen so much there's pressure near, that pressure equals pain.
Right.
We want that pressure out. You can wrap them, with ACE wrap. There's other options for compression wraps.
Well, the ice pack too. I mean,
right. Good point. If you're going to use compression, you should probably get someone, a doctor or your therapist, to help you with that.
Yeah, if you're going to use some type of compression stocking,
right?
A lot of times you're going to want to be fitted for it. Maybe
right. Yeah.
Even if you do an off-the-shelf one, you want to make sure the doctor tells you what pressure you can put on it. And
right. That's can get a little technical, so get some help. But cold pack, you can always put a cold pack on. Don't put it directly on your skin. Always over some material, and that'll help get that swelling.
But a lot of people, Brad, ask, why am I getting fluid on my knee? It generally is because there is some type of problem in the knee. It's not the fluid isn't the problem itself. It's a result of the problem.
Right.
So if you have arthritis or that's why you're getting swelling in your knee.
So if there's an activity you do, walking or whatever it is, and it swells up afterwards, you're going to have to cut down on that activity, whether it's running, walking, going up and down steps, and get that knee healed up before you go back to it, so it doesn't become a chronic problem. And then lastly is joint pain in the knee. This is for more active people. Let's say you're running, you're walking, and you get joint pain, and it's that sharp pain. Things are clicking. You may have it lock up on you, those types of things. There's a number of things. It can be a meniscus problem. You could have runner's knee, IT band syndrome, patellofemoral pain.
It could be the kneecap itself.
Right.
So
in those types of things, we don't have time to go through each one for treatment. But you do, if you Google Bob and Brad, IT band syndrome, we've got a really good one on that from a patient who went from being unable to walk even to the point, and he started stretching, took care of him, and now he's doing Ironman. And he's 62
crazy.
years old. Yeah.
No, he's older than that now, isn't he?
He could be.
Yeah.
I'll talk
I thought
to
he
him.
was quite older at that time even.
Well, he wasn't over 65.
Oh, I thought he was.
Wow, Bob, we don't need to get
anyway, the thing is about joint pain, what we're saying is, quite often, let's say you take your hand and go right underneath the kneecap. This is the joint. That's how you can distinguish what is joint pain.
That's a joint line.
Yeah, if it hurts up in here, hurts here, that might be muscle or ligament or something else than that.
Yep.
This is joint pain right there.
Yep.
You can actually push right on the joint, and that hurts. That gives you the sign that it's joint pain. Harder to treat because you can't get into the joint, and I mean,
you're not going to stretch the muscles of the joint because there's no muscles in there. But that kind of thing, those are the things where it's causing you some pretty limiting your function. You're going to need to see the doctor, get that squared away, get the diagnosis, and then continue on from there.
Right.
See our videos, and we'll help.
Get a diagnosis, and then you can, like Brad said, you can actually zero into that diagnosis and get the right videos for that particular problem.
Exactly.
So,
all right. Very good, Bob. I think we did another one.
Thank you.